Dr. Tanmoy Vaidya will be speaking on hidden hazards using novel isolation techniques to unmask endotoxins directly from the intraocular lens.
Yes. So good afternoon to everyone. I'm Dr. Tanmoy Vaidya from Narayan Nethralaya. Today I'll be presenting on hidden hazards using novel isolation techniques to unmask endotoxins from the IOL. So it all began with a routine day at office where a 70-year-old male underwent an uneventful phacoemulsification with a hydrophilic IOL. But to our surprise, the patient presented to us on POD1 with this picture with an intense inflammatory reaction with an hypopyon. Thankfully, the patient responded to topical steroids and was diagnosed to have TAS after an AC tap. So it got us thinking, what exactly was the source of contamination? After ruling out all of these possibilities, we thought, what if the contamination was directly from the IOL? There were similar cases reported in the country during this time with these hydrophilic IOLs. So we did a literature review where we saw these cluster of cases which were directly associated with the intraocular lens with one common link, yes, endotoxins. So these endotoxins are components of the bacterial cell wall which may incite inflammation even after the bacterial cell death. So could there be a more reliable way to isolate these endotoxins from IOLs? So we at Narayan Nethralaya did a cross-sectional study where we took 11 IOLs and divided them into 3 groups. The implicated IOLs consisted of hydrophilic IOLs from the same batch which had previously caused TAS. The non-implicated ones were from the same company and the same models, but they had not caused TAS. So we handled them in a sterile manner and transferred them along with the packaging fluid of the blister pack into 2 ml low binding tubes. So herein lied the novelty of our study, where we use leaching techniques, that is agitation of the IOLs for 4 hours at 900 RPM. Before we tested them with a reagent, we made sure that these samples were sterile to rule out the presence of endophthalmitis causing agents. So we used a brain heart infusion broth for 48 hours, and as expected, all the samples were sterile. So then we tested the solution with the LAL reagent. So this LAL reagent is basically an amoebocyte of the plasma of the horseshoe crab. They are extremely sensitive to these endotoxins. So 0.1 ml of the leach solution was mixed with this reagent. It was incubated for 6 minutes. As expected, the control group did not show any color change. But to our surprise, both the implicated and the non-implicated IOLs showed a color change. To remind you, the non-implicated IOLs had not previously caused TAS in their batch. So we quantified them using spectrophotometry with a light of wavelength 545 nanometers. The FDA currently regulates the acceptable level of endotoxin contamination to be 0.5 EU per ml. So, out of these IOLs, 3 of the non-implicated IOLs and 3 of the implicated IOLs had a concentration which was more than the FDA-regulated levels. So, clearly, these current techniques of testing the IOL-related tasks are insufficient, as evidenced by the presence of endotoxins in both these groups. Leaching is a novel technique which is inspired from geology and metallurgic processes. These techniques are used to essentially isolate microplastics from water and also rare materials from the earth. So, it's a process of the solute becoming detached or extracted from its carrier substance by using a solvent. So the novelty of our study was that it was a first-of-a-kind study to detect endotoxins directly from the surface of the IOL. And also it's the only study to detect endotoxins in commercially available IOLs before even the incidence of TAS. So we suggest that such leaching techniques can be easily used by IOL manufacturers to be more reliable in detecting endotoxins in these IOLs, reducing such a cluster of attacks. A few IOLs in every batch can be tested for these endotoxins. The interesting part of this study was that these non-implicated group of IOLs also requires further research as to why they didn't elicit a similar reaction in some individuals. I would like to thank the team, Narayan Nethralaya team. Thank you so much. Yes.
So your study is quite elegant, but there is also one can study the putting the IOL in a concavity slide and stain directly with the hematoxylin stain and see the cytology. If you see the polymorphs, it indicates an infection. If you see the giant cells or epithelial cells, that indicates a granulomatous reaction, like that IOL material is not matching with the surface. So I did a study which was published in Journal of Cataract and Refractive Surgery. I could stain also the bacteria and fungus after destaining them. And this is all very simplistic method. Your method is much more sophisticated and very elegant. So I congratulate you for doing a kind of study.
So, sir, after talking to these manufacturers, basically, so 15 to 20 IOLs in every batch are being tested with similar techniques. But what happens is that all of these IOLs were in fact cleared by the manufacturer already and were commercially available. So clearly there was some lacunae which was lacking basically in their testing process. So that's why the need for the studies.
What is the cost of this procedure?
So the machine which is basically used, any centrifuge can be used, but this machine, the Eppendorf machine, is around 3 to 4 lakhs. So not necessarily every doctor can use it, but any IOL manufacturer can easily afford this. And we can be involved more hands-on in the manufacturing process as we use these IOLs very frequently.
You said that you ruled out the other causes of TAS from the, the fluids, and did you test those materials also?
Yes, ma'am. So basic testing was done, and they were also no, ma'am. And also in these cases, most of these substances are used in a lot of cases. So the fact that they didn't cause a cluster of TAS rules out clinically also, in spite of even if we had not tested these things.
Okay, so we'll go to the next. Any question?
Yes. Yes.
I will ask him the next one.
Yes.
That's true.
Yes. Yes.
True.